Welcome to Cedar River Clinics of Renton. We are a feminist, nonprofit organization that offers abortion care, birth control, well woman, and LGBTQ services. We empower all of our patients to make informed healthcare decisions for themselves, and we trust and respect those decisions. Your visit begins when you call to make an appointment. If English is your second language, we are happy to provide an interpreter over the phone or in person for your appointment. We have phone counselors available to discuss our services and all payment options. When you arrive, you will notice that our facility is located back from the road up a private driveway. We have free parking and are available on several bus routes. You will check in our main lobby. We require photo ID for yourself and anybody else who comes into the facility with you. At our intake desk, we will collect all insurance and payment information and provide you with any necessary paperwork for your visit. Once you've returned your paperwork, we will have you wait. Please be aware that anybody you bring with you will remain in the main lobby while you are being seen for services. We provide each individual with the care they need, and that may result in longer wait times. Thank you for choosing Cedar River Clinics for your abortion care. Our friendly and knowledgeable staff will treat you with respect and compassion. Cedar River Clinics is the only abortion clinic in Washington State with AAAHC accreditation, which means we meet the strictest standards for quality care and patient safety. At Cedar River Clinics, we offer two options for first trimester abortions: an aspiration abortion, which is a surgical procedure completed here in the facility all in one day, or the abortion pills, which you can take at home. For second trimester abortions, we complete the procedure using a process called dilation and evacuation, also known as a D&E. We have additional information about our procedures located on our website, and we can discuss your abortion options when you call to make an appointment. The first step of your visit is to do an ultrasound to determine where you are at in your pregnancy. This will be done using a transvaginal or transabdominal ultrasound. The next step after that will be taking you to our lab, where we will run a series of tests, which may include urine and blood samples. We will also be checking your vitals to ensure you are in the best possible health to be seen for services that same day. Once that is completed, you will be taken to our consent area where we will discuss your abortion procedure. During the consent process, you'll have the opportunity to sit down with a staff member to discuss your procedure and sedation plan, sign consent forms, discuss birth control if desired, and also review your post-abortion care. Next, you will meet with the provider to discuss any questions or concerns you may have, as well as do a brief physical exam, during which time you do not need to undress. After that, you will be provided with the first pill, which will begin the abortion process. Please refer to our Well Women video to see more information about your follow-up appointment. If you're here for a surgical abortion procedure, a medical assistant will take you to an exam room in our surgical services area. We offer pain management options, which include local anesthesia and sedation. We will create a plan that is individualized to your own needs. Our goal is to ensure you are as comfortable and safe as possible. Next, a provider will come in and address any questions you may have. A medical assistant will also be available to support you during and after your procedure. An aspiration abortion is completed in one day for patients under 12 weeks gestation. During this procedure, instruments will be inserted into the uterus. You can experience mild to strong cramping and may also hear the noise of the vacuum aspirator. After the abortion is complete, your recovery time will last between 15 and 20 minutes. Dilation and evacuation, also known as a D&E, is a procedure completed beyond 12 weeks gestation. It may require appointments that will last 1 to 3 consecutive days depending on where you're at in your pregnancy. In preparation, we will insert dilators into the cervix, which will allow the cervix to dilate very gently overnight to allow for a safer procedure. This will require you to stay within 30 minutes of the facility until your procedure is completed. Once you come in for the final day of services, we will remove the dilators and complete the procedure under ultrasound guidance. After your procedure, you will expect your recovery time to be anywhere between 20 minutes to 3 hours. Once your abortion is complete, we will review and provide written instructions, discuss any medications you're taking home, and provide you with a 24-hour number where you can reach us if you have any questions or concerns. If you receive sedation, you will be required to have someone you know to either drive you home or escort you in a cab. After your procedure is completed, you can expect to return to your normal routine within 1 to 2 days with very minimal limitations. We do recommend setting up your follow-up appointment within 2 to 4 weeks after your procedure. Please review our Well Woman video for all the information about your follow-up appointment. Cedar River Clinics offers a special fetal indications program to women seeking abortions for pregnancies that have been diagnosed with genetic or structural anomalies. We have a genetic intake specialist who will work with you to develop an individualized plan to best suit you and your family's needs. We can offer you assistance with genetic testing, funding resources, and local lodging and transportation. We have a private waiting room available for you and your support network. Our specialist is also available to be with you through the entire procedure for support. We can help you with grief support, bereavement resources, memorial tokens, and funeral and cremation referrals. Expert physicians and staff at Cedar River Clinics provide you with the time, attention, and special care needed during this difficult time. When calling to make an appointment, please ask for the genetic intake specialist. Thank you for choosing Cedar River Clinics of Renton for your reproductive health care. Please contact us with any questions or to schedule your appointment. We are a nonprofit social change organization that combines direct service with activism and community education. We believe access to reproductive health information and services has the power to positively change lives. If you would like to find out more about our organization, please visit our website. Thank you.